Hi everyone, welcome to a new video. My name is Dr. Gail Harrington, and over the course of my career, I have helped treat countless people for skin conditions. What can we do when that one annoying, painful pimple pops up right in the middle of our face? Pop it? Put toothpaste on it? Be careful, because you might be about to leave yourself with a permanent scar. There's nothing more frustrating than having an important event and suddenly getting a swollen pimple. Those of us who have suffered from acne know how painful it is, both physically, from having pus-filled lesions that hurt, and psychologically. In today's video, I want to talk about how to treat and prevent acne effectively, quickly, and safely, without ruining your skin in the process. Before we continue, if you like the content on my channel, don't forget to like this video, subscribe, and turn on notifications so YouTube alerts you every time I upload a new video. Without further ado, let's get started with the video. Section 1. Know your enemy. What is acne? To fight acne and pimples, we first need to understand where they come from. It all starts in a structure in our skin called the pilosebaceous unit, which consists of a follicle, a hair, and an associated sebaceous gland. These sebaceous glands are responsible for producing sebum. And I want to make one thing clear. Sebum isn't the villain here. Sebum exists to keep the skin hydrated, lubricated, and smooth. The problem begins when several factors combine. Due to genetic or hormonal factors, the glands increase sebum production. Added to this is a process called follicular hyperkeratinization, which basically means that the dead cells lining the pore accumulate and do not shed as they should. So, what do we have? A pore clogged with sebum and cells. If we add a bacterium called Cutibacterium acnes to that plug, and our immune system reacts by causing inflammation, that's when the infamous papules, pustules, pimples with pus, and open or closed comedones, blackheads and whiteheads, appear. Section 2. The blacklist. What you should never do. When we see a pimple, anxiety takes over, but there are things that simply don't work and are bad for us. 1. Don't pop your pimples. I know it's very satisfying to watch the contents of a pimple come out in front of the mirror, but manipulating the lesions causes inflammation and damage to the dermis, which can leave you with a permanent scar. Plus, if you do it with dirty hands or pick at it with needles, you run a huge risk of causing a secondary infection. It's 2 seconds of satisfaction for a lifetime of scars. 2. Don't use toothpaste or home remedies. Why would anyone put toothpaste on a pimple on their face? Toothpaste can be extremely irritating and harsh on the skin. Also, don't try miracle recipes from the internet involving lemon and baking soda. Lemon applied directly to the skin can cause irritation, leukoderma, or horrible sunspots. It's best to leave kitchen ingredients in the kitchen, not on your face. 3. Don't use peel-off masks. Those famous black masks that dry and are peeled off by pulling on the skin don't work. All they do is damage and inflame the skin, pulling out sebaceous filaments, which are normal structures that will just fill back up in a couple of days. Section 3. The rescue plan. What you should do. So, if I can't squeeze it, what do I do? Isn't this what we all ask ourselves in life? If you have one of those deep red pimples that don't have pus but are inflamed and hurt a lot, apply ice, but never directly on the skin because you could burn yourself. Wrap it in a clean towel and place it on the lesion for 5 to 10 minutes. Take a break and repeat. The ice causes vasoconstriction and helps quickly reduce pain and inflammation. On the other hand, if your pimple has the famous little white head of pus, it's best to apply warm compresses. Take a clean towel, dampen it with warm water, and leave it on the affected area for about 10 to 15 minutes. The heat will help the pimple drain naturally and spontaneously without needing to squeeze or damage the skin. Section 4. Acne Fighting Routine and Science. To prevent pimples from continuing to appear, we need to remove sebum and deeply cleanse the pores. This is where our over-the-counter and prescription scientific allies come in. Salicylic acid. It's my favorite. It's a lipophilic beta-hydroxy acid, which means it works very well with oil. It can penetrate deep into the pore, dissolve sebum, and exfoliate dead skin cells. You can find it in cleansing gels or serums. Benzoyl peroxide. It's excellent for inflamed, pus-filled pimples because it kills the bacteria that causes acne and is super anti-inflammatory. But watch out. Here's a fact many people don't know. It bleeds on clothes, so be careful with towels and pajamas. Retinoids, such as adapalene, they're spectacular at regulating cell growth, so cells don't accumulate and clog pores. If you're going to use them, do so at night and gradually, starting every other day, to avoid irritating your skin. Niacinamide helps control sebum production, keeps pores clean, and has a powerful anti-inflammatory effect. How do we put together the basic daily routine? In the morning, wash your face with a gentle cleanser or one containing salicylic acid. Then, moisturize. Yes, acne-prone and oily skin also needs hydration to avoid irritation. And finish with your sunscreen. This step is non-negotiable. The sun stimulates melanin production, and if your pimple is inflamed and gets sun exposure, you'll end up with a terrible dark spot. At night, cleanse again to remove the day's dirt. Apply your treatment, whether salicylic acid or retinoids, and finish with your moisturizer. Section 5. Patience and mental health. Finally, I want to leave you with a message. Treating acne requires a lot of patience and consistency. These products aren't magic and don't work overnight. If you feel your acne is severe, inflammatory, painful, or leaving deep scars, please see a dermatologist. Sometimes topical treatments aren't enough, and we need to turn to oral treatments like antibiotics or isotretinoin, and we're here to support you through that process. Acne can be treated, I promise. Well, we've reached the end of the video. Tell me in the comments below, are you one of those people who loves popping pimples, or have you ever put toothpaste on your face? I want to read all your comments. If you like this video, please give it a like and share it with that friend who's always touching their face in front of the mirror. Don't forget to subscribe to my channel and turn on notifications so YouTube alerts you every time I upload a new video. Take good care of your skin, and I'll see you in the next video.